VTE, or venous thromboembolism, is a disease that encompasses both deep vein thrombosis, or DVT, and pulmonary embolism. It is a serious, often underdiagnosed, but preventable complication during and after an acute medical illness or surgery. DVT occurs when a blood clot forms in a major vein, usually in the leg. Part of the clot may break off and travel to the lungs, causing a pulmonary embolism, or PE. PE accounts for 5 to 10% of deaths in hospitalized patients, making VTE the most common preventable cause of in-hospital deaths. DVT and PE are deemed non-reimbursable by CMS. Pneumatic compression pumps and garments lower the risk of DVT by replicating the body's normal musculovenous pump activity. During treatment, the inflation-deflation cycle of the pump forces blood out of the legs toward the heart. Numerous studies demonstrate that pneumatic compression not only helps reduce morbidity and mortality, but also provides a low-cost and more conservative solution compared with surgical intervention and drug therapy. This video will cover Medline's Hemo sequential compression. This mode of compression applies pressure to the legs distally to proximally by inflating 3 separate bladders one at a time, moving air from the lowermost bladder of the garments to the uppermost. Medline garments are intentionally designed with features that encourage patient compliance and guide proper sizing and application. And the pump is both durable and easy to use. Start by plugging the pump in and attaching it to the end of the bed using the spring-loaded, rubber-coated hooks for steady positioning. Battery packs are also available as an optional backup. These are inserted into the back of the pump and last up to 8 hours on a full charge. Next, prepare the tubing. Standard tubing that comes with the pump is 5 feet long. 10-foot options are also available if needed. Both options are anti-kink to help prevent interruptions to therapy and excessive alarming. The male end of the tubing should be plugged into the female plugs on the back of the pump. When tubing is secure, you should hear a click. There is no need to disconnect one tube if using only one garment for single-leg therapy. Instead, the pump will automatically recognize that only one garment has been attached and initiate single-leg mode. Although the tubing is reusable, it often gets lost or accidentally thrown away. To prevent this, loop the plastic knot ties on the back of the pump through the plastic eyelets on the top of the tubing. Do not discard labeling on the tubes also reminds the user to keep the tubing with its pump. Next, it's time to apply the garments. But first, the caregiver will need to measure the patient to ensure the correct size garment is used. Calf garment measurements are based on the circumference around the widest part of the patient's calf. The thigh garment measurements are based on the circumference of the widest part of the patient's thigh. Lastly, the foot garment measurements are based on the circumference of the foot instep. Sizing measurements can be found in the upper right-hand corner of the garment insert, as well as on the sleeve itself. The garments are also color-coded by size for easy identification. Small is yellow, medium is gray, large is red, and extra large is green. Once the correct size is selected, undo the hook and loop closures to open the garment. The narrow end is placed nearest to the heel and the wide end near the knee. For the most contoured fit, tabs should be applied from bottom to top, as indicated by the printed numbers. Care should be taken with positioning the garment. Make sure the tubing is not directly under the patient's heel or ankle. It may be turned slightly to accommodate positioning changes and avoid bony prominences. Lastly, once the garment is secured, the 2-finger rule should be applied to ensure correct fit. Insert 2 fingers horizontally with both fingers touching the patient's leg in between the garment and the patient. Fingers should fit snugly, but not tight. This practice should be done at the top and the bottom of the garment. Next, attach the garments to the tubing. Again, you will hear a clicking noise when the tube is locked into place. To disconnect the tubing, simply pinch the side prongs together and pull them apart. Once the tubing and garments are connected, press and hold the power button to turn on the pump. The machine will take 40 seconds to initialize, determining what type of garments are connected and how many. If a calf or thigh garment is attached, the pump will automatically begin therapy with 45 millimeters of mercury in the first chamber, then 40 millimeters of mercury in the second chamber, and finally 30 millimeters of mercury in the third chamber. If a foot garment is attached, the pump will automatically begin therapy at the appropriate higher pressure of 120 millimeters of mercury. And again, if a single garment has been attached, the pump will automatically begin single leg therapy and the single sleeve light will illuminate. In other words, the pump is 100% auto-detect. The sequential pump will inflate each chamber for 4 seconds and then deflate for 48 seconds, completing one full 2-leg cycle every 2 minutes. If an alarm sounds, the pump will display one of 4 alarm codes. An alarm code troubleshooting guide is displayed clearly on the front panel of the pump to help identify the source of and solution for the problem. The alarm can only be reset by fixing the problem and waiting for a full cycle to pass, or by fixing the problem and turning the unit off and back on. Also available on the pump's display is a timer that tracks how long the pump has been running. The only way to reset the timer back to 0 is to press and hold the timer reset button for 5 seconds. For more information on Medline DVT pumps and garments, please contact your Medline sales representative or call us at 1-800-MEDLINE.